Welcome to Pregnancy and Birth Diaries. After a long break, I'm back again with another topic. Today, we'll be talking about retained placenta. It's very uncommon, especially if you are giving birth in a hospital setting, but retained placenta can have serious complications if it's not treated right away. Okay, what is a retained placenta? We know that after we give birth, the placenta, the organ that connects our baby to us for nutrients during pregnancy, comes out naturally out of the uterus once our baby is born. It just detaches and is delivered within about 30 minutes after birth. And if this doesn't happen, then it's called retained placenta. Now, I remember the first time, I guess I was such an exhausted but also kind of relieved state after labor and birth. I didn't even notice my placenta coming out. And later, when I was already in my maternity ward, I asked the nurse, did my placenta come out? And she said, of course it did. So I was like, phew. But because I think I have not felt it, I haven't seen it. I just, for some reason, thought that maybe everybody forgot about it. And the second time, I clearly remember I give birth and I was like, oh, thank God I'm done. But then I started feeling the same kind of pushing feeling. And I thought, am I having twins that I didn't know about? But then my midwife said that it was the placenta and it was out after about 1.5 pushes. It was quick and easy. However, there are cases when our placenta just refuses to come out on time, and the reasons could be that the placenta grows too deeply into the wall of our uterus, and that makes it difficult to detach naturally. There's also a situation called trapped placenta. This happens when the placenta separates from the uterus, but it gets stuck because our cervix starts closing without waiting for the placenta to be delivered. And sometimes the placenta does not properly detach from the uterine wall, and it could be because the muscles of the uterus have not contracted enough. Now, why does it happen? Some common risk factors could be having previous retained placenta or uterine surgery. It could be preterm delivery before 37 weeks, a long labor, or having given birth multiple times. Sometimes also uses of certain medications during labor can cause that. Now, what happens if you don't deliver your placenta naturally? Naturally, the first and most common thing is that your OBGYN or your doctor will remove it manually. They will gently remove the placenta by hand. And I think they also numb the area or maybe give medication to help with the discomfort or pain. I personally suspect the first time I gave birth, my midwife pulled my placenta out because, as I said earlier, I just did not deliver it. I don't remember feeling it to the point I didn't even notice coming out. I think she just gently pulled it out because I remember she was very experienced and very well trained. So I think she was just I don't know. I guess she was just trying to be efficient maybe and not waiting for 30 minutes for it to be delivered on its own. I remember she just did everything quickly. I think she almost like pulled my baby out, and then I think she just pulled the placenta out, stitched me up, and sent me on my way to my maternity ward. So yeah, but I think she just probably wanted to be more productive or efficient, and maybe there were other women waiting to in other birth rooms to give birth. Maybe that's why, I don't know. But yeah, I have a suspicion that my placenta was pulled out the first time. Now, if the manual method does not help or it's not the right case to be used, then there are drugs that help the uterus to contract and push the placenta out. And unfortunately, if neither of these methods help, then a surgical procedure called a dilation and curettage is performed to clean the womb. Um, I'm sure it's not going to happen to you, especially if you are giving birth in a hospital with doctors, but you never know. So here are some sort of symptoms for you to watch out for in case, in case of retained placenta. So the first one is that the placenta that is not delivered within 30 minutes after giving birth. It can also be heavy bleeding, like postpartum hemorrhage or severe cramping. And if infection happens later, then it will cause fever and foul smelling discharge. So, what are the risks of untreated retained placenta? If it's not treated right away, it can lead to postpartum hemorrhage, severe blood loss. It can lead to infections like uterine infections or sepsis. And it can also cause fertility problems in rare cases. Like complications like these may cause um, problems with future pregnancies. So that's why it's very important to seek medical help right away. Of course, as usual, talk to your doctor or OBGYN and talk about the risks and your options. Okay, that's it for today. Thank you for watching, and I'll see you next time.